Okay, welcome to this interview. My name is Sirial. I am the director of Organics Foundation, which aims to promote a healthy lifestyle in order to maintain and regain health. Today we will focus on type 2 diabetes, and to achieve our goal, we have a very special guest today to help us on this mission. Some background information about diabetes. In Curacao, we have SOCUDI, which is the foundation that helps people and educate people with type 2 diabetes. According to the statistics, there's an increase in patients on the island. Therefore, with this interview, we want to contribute to the program of the government to prevent type 2 diabetes. And also, we want to empower patients that have it. So for this goal, we have a professional which is experienced with this disease. His name is Neal Barnard. Doctor, how are you doing today?
I'm doing fine. Thank you for reaching out.
Okay, I would like to give a brief introduction for those that don't know Dr. Neal Barnard. I will be reading here. So Dr. Barnard graduated as a medical doctor at the George Washington, D.C. in 1980. He is now an adjunct associate professor of medicine at this university. This means that, what does it mean exactly?
Well, George Washington University is a major medical school here in Washington, D.C., and the adjunct faculty means that my office isn't located there. I got my own office, which is right here. But we work together in various ways, and one of the main things that we do now is that I have a medical center here, and medical students from GW come, and they rotate through here, and they see how we treat patients, and they learn in that way. And we have other ways of working together as well.
Okay, that's like, I would say, a modern way of working together, because your office is external.
I guess you could say that, sure.
Okay. Besides a medical doctor, Dr. Barnard is also a clinical researcher and author. In 1985, Dr. Barnard formed the Physicians Committee for Responsible Medicine, which has 175,000 members from all around the world, and 12,000 are physicians. In 2015, he opens the Barnard Medical Center as part of the Physicians Committee for Responsible Medicine. And at this center, you guys practice preventive medicine and primary care, applying the whole food plant-based diet. Is that correct?
Yep, that's right.
Okay. Dr. Barnard is a certified board member of the American Board of Psychiatry and Neurology. He is a member of the American Medical Association, a member of the American College of Cardiology, and licensed in medicine and surgery in the District of Columbia. He has authored key resolutions, now part of the AMA, how do you pronounce it? AMA policy?
Yeah. It's the American Medical Association, or AMA, that's right.
AMA policy calling for a new focus on prevention, nutrition, and medical practice. In 2018, which was last year, he received the Distinguished Service Award from the Medical Society of the District of Columbia. Dr. Barnard wrote a total of 20 books for medical reader and lay readers. I will mention some titles: The Power of Your Plate, Food for Life, Get Healthy, Go Vegan, Dr. Neal Barnard's Program for Reversing Diabetes, and a nutrition guide for clinicians. This one is available only for U.S. medical students, is that correct?
Well, that was originally, but now it's available for anybody.
Oh.
And if you want to go to wherever you get your computer or your iPhone apps or Android apps, you just put in Nutrition Guide for Clinicians, and anybody can now download it for free.
That's wonderful. Okay, let's get started with the interview. First of all, how many years have you been practicing medicine, and when did your interest for nutrition started?
Well, first of all, thank you for doing this interview. I finished my medical school in 1980, as you mentioned, and finished my residency in 1984. So believe it or not, that's been 35 years of medical practice. And I've been interested in nutrition for some time, but my interest in diabetes was a little bit later, because I started this group called the Physicians Committee for Responsible Medicine, and a foundation approached us to say they wanted to find a better way of doing research. And I suggested to them that two things would be important. One is to not study animals. They were concerned that they were doing research on rats and mice and not getting anywhere. So I said, let's focus on human beings with diabetes and see if we can help them directly. But then the other thing was, I said that of all the things we need to study, the most important is not a new medication. The most important is to look at diet changes. So that's what we've been doing. And we've been trying out how to really improve diet changes in such a way that they can be extremely powerful, and in some cases help diabetes to even go away.
Okay, what you're saying is basically what the father of medicine also taught us, right? That you have to focus on the diet. The diet, what you eat, has to be your medicine.
Yes.
So it's not something new, actually.
You're right. Yeah, but it's easy to forget, and we have to remember to remind people.
Okay. Next question. Can you tell me more about the constitution of the Physicians Committee for Responsible Medicine? The members, are they all health-related people, or can patients also be members?
Yes. Well, the Physicians Committee started out as a committee, and it was maybe 10 or 12 doctors, but we discovered that there was a much broader interest in it. So as you mentioned, we have probably 175,000 or maybe more members. Of those, some are physicians, but we also have other people who might be nurses or psychologists or pharmacists, and also just many people who may not be health professionals at all, but are interested in supporting the work we do. So I'm hoping people will join us in our work at the Physicians Committee.
Nice. I took notice of the achievement of the Physicians Committee. One of them that was to have the government to change to adjust the My Plate, right? So that there was first meat on the My Plate, and now the Physicians Committee achieved to change it into protein. Can you tell me more? Can you say that this was the greatest achievement of the Physicians Committee, or are there more achievements?
Well, I have to say, I think over the 35 years that we've been in existence, I think we've done a lot of great things. And I think I think it was important to get rid of the meat group. Before that, there was a pyramid where the government used to say you should have grains, and then vegetables and fruits, and meat and dairy, and then smaller amounts of sugars and oils and things like that. Mm-hmm. And we actually pushed to get rid of the meat and dairy group entirely a long time ago. And so the government moved to a plate, and when it moved to the plate, it got rid of the meat group. And it said you need protein, but it doesn't have to be protein from meat. It could be protein from beans, mm-hmm. or from tofu, or from nuts, or wherever it could be a plant source. And they still have a dairy group, but to their credit, the dairy group includes soy milk, which is healthier, in my view, than cow's milk by far. Mm-hmm. But the great bulk of the My Plate diagram is vegetables and grains and fruits, and those are really healthy foods.
Okay. Now let's talk about the disease we call type 2 diabetes. Mm-hmm. The explanation for the cause of this condition is that due to an excess of sugar consumption, there is insufficient production of insulin hormone, the blood sugar level increases. It is a serious illness that, if not controlled by inserting insulin, can lead to serious damage to the body tissues. You can have loss of vision, you can have loss of kidney functions, even amputation of body parts, which are happening right now on the island. And also you have a reduction of 10 years in life expectancy.
Right.
Now, the explanation that I just mentioned, is that correct?
It's important for people to understand really what's happening. First of all, what diabetes really means is that the amount of sugar in the blood is too high. And that sugar is glucose. And glucose is not a bad thing, it's a good thing. Glucose is supposed to get into your bloodstream, and then from the bloodstream it's supposed to go into the cells, where it can power your muscles and power your liver and power your brain and so forth. And that sugar is glucose. And glucose is not a bad thing, it's a good thing. Glucose is supposed to get into your bloodstream, and then from the bloodstream it's supposed to go into the cells, where it can power your muscles and power your liver and power your brain and so forth. So glucose is good as long as it can get into your cells to provide them power. But it's not good if it can't get into the cells, it just builds up in the blood. That's no good. So in order to get it into the muscles or into the liver, you need insulin, which acts like a key on the surface of the cell to allow little channels to let the glucose come into the cell. Mm-hmm. So the cause of diabetes, well, diabetes means there's too much sugar in the blood, but the cause of diabetes is not sugar. The cause of diabetes is that fat builds up from foods that you eat. It gets into the muscle cells and the liver cells, and it stops them from being able to be responsive to insulin. So you get too much fat inside the cells, and now the cells can't take in the sugar anymore, and so the sugar builds up in the blood. So the answer is not to avoid carbohydrate, for example, which a lot of people do. That's not the right way to do it. The answer is to get away from animal products like meat and cheese and so forth, and get away from vegetable oils too. Because if you get away from the animal fats and the vegetable fats, then the amount of fat inside the cell diminishes, and the insulin can start working again. And sometimes diabetes even goes away. So the cause of type 2 diabetes, it all starts with insulin resistance, and that comes from fat building up inside the cell.
You just said sometimes the diabetes goes away, so it's not guaranteed that if you diminish the fat that it will go away. It depends on factors such as your age?
I think not so much age as how long you've had the disease.
Okay.
For example, let's say you have a 50-year-old person and just now were diagnosed with the disease. If at that point that person adopts a healthy, low-fat vegan diet and stays physically active, they have a very good chance of getting rid of it completely. And it's sort of a two-way street. If they then start eating, let's say they're on a completely healthy vegan diet and they get rid of their diabetes, and then they stop and they start eating meat again and cheese and so forth, they can get the diabetes to come back. So the real key is to intervene early. So let's say you have a person who got diabetes when they were 30, and now maybe it's 20 or 30 years later and they still have diabetes. If that person changes their diet, they'll still improve, but they might not completely get rid of it. And that's because the cells of the pancreas that make insulin have been attacked by this disease process for many decades, and they're not making as much insulin as they used to.
Okay, I understand. Now, what is the relationship between the plant-based diet and diabetes? Can you explain what is the plant-based diet and what is the whole food plant-based diet? Because there is a difference. And are they the same as a vegan diet?
Okay. Well, people are using plant-based diets of various kinds to treat diabetes or to make it go away. As I mentioned, we want to get the animal products out of the diet completely. So when you do that, your diet comes from plants. And so we often use the word vegan, V-E-G-A-N, because a vegan diet, just by definition, all it means is there are no animals on your plate anymore. So there's no meat, no dairy products, no eggs. So that's all gone. So that's a vegan diet. Now, some people call it a plant-based diet because they think plant-based sounds more better than vegan, but it's the same. It's the same thing, really. So that means there's no animal products there. Now, some people say, well, let's go a step further and let's make sure that they're whole foods. So if it's whole foods, they might say, I'm not going to eat sugar, for example, because sugar is an extract of sugar cane or sugar beets, and that's not really a whole food. They'd like to focus on vegetables, where you steam or cook the whole broccoli or collard greens or kale or whatever it might be. Let's have it be fruits as opposed to fruit juice. Let's have it be the papaya or the mango or the apple or the orange, and eat the whole thing. Let's have it be whole grains as opposed to refined grains. So vegan is good, and if a person goes to a vegan diet, that's great. Getting rid of the animal products is great. Many people want to go a step further, keeping oils really low, and also keeping sugary and processed foods low too.
Because I asked because sometimes you can go vegan and you can go eating junk vegan food, and that is not healthy. You won't have the benefits. Let's say you want to reverse diabetes and you go eating bread, refined flour, refined sugar. You won't have the same effect if you go on a whole food plant-based diet. Let's go on. There's a publication of a clinical trial you performed together with 6 other professionals, where type 2 diabetes patients were held in a controlled environment during 74 weeks. The trial was conducted in 2003, funded by the National Institute of Health of the US. Was this the first trial with type 2 diabetes?
No, we had done other trials before that, but this one was bigger, and it was longer, and it was better controlled.
Can you explain more what happened?
Yes. The test that we use to track how people are doing is called A1C, or hemoglobin A1C. And this is a measure of your blood sugar control, and it reflects how you've been doing over the past 3 months or so. And you want your A1C, if you have diabetes, you want it to be below 7. So our patients were on average around 8, which is a little bit too high. And we randomly assigned them to either a current conventional diabetes diet, which what that means is limiting calories so that people will lose weight, keeping carbohydrate kind of the same from day to day and throughout the day, trying to avoid the bad fats. So that's a conventional diet, and that was our control group.
Okay.
Our experimental group followed a vegan diet, no animal products at all. Mm-hmm. And we also asked them to learn non-oil cooking techniques so that we were reducing vegetable oil. Mm-hmm. And the third thing was that we asked them to favor what we call low glycemic index foods. Okay. And all that, it sounds like a technical term, but all it means is that if you eat rye bread, that makes your blood sugar rise pretty fast. But if you eat rye bread, your blood sugar doesn't rise as much as it does with white bread. Mm-hmm. And if you eat pumpernickel bread, even slower. Or let's say I eat bread and my blood sugar rises a lot, but if I eat beans, even though they still have carbohydrate, it's a low glycemic index carbohydrate mm-hmm. that is really gentle on my blood sugar. Okay. So 3 steps: vegan, avoid oils, and favor the low glycemic index foods, but it's not low carb at all. So that was what the intervention was. And we tracked our individuals for 22 weeks, and what we found was that the drop in A1C, the improvement in A1C, was 3 times better in the vegan group compared to the conventional group, and that really was important.
Okay, interesting. A curiosity. Many times people say that you have a gene that causes diabetes type 2. Is it really a genetic disease? Can you say that it is?
There are genes that can increase the risk or maybe reduce the risk. And you see diabetes running in families where the grandfather had it and then the next generation has it and the generation after that has it. That may be partly genes. It's also partly the fact that parents give recipes to their kids.
Exactly.
You know? So we have food traditions go through families, and they all change together. So it's both of those things. And let's say you have the genes for diabetes, but if you switch to a healthy diet and throw out the animal products, people might like chicken and fish and beef, but if they throw those things out and throw out the cheese, the likelihood that they'll get diabetes is dramatically lower.
Okay, that makes sense. How about type 1 diabetes? Does it have to do with the mother's diet during pregnancy? Because you're born with this type of diabetes, right?
Well, type 1 diabetes is different from type 2 in this way. In both cases, the blood sugar is high, but in type 2 that we've been talking about, that's because the insulin that is trying to get the sugar into the cell is having trouble. The cell is resistant to it. That insulin resistance means the sugar won't get into the cell properly. Now, with type 1, the reason that the blood sugar is high is because there isn't any insulin at all.
Okay.
The cells in the pancreas is in the abdomen, the cells that make insulin have been killed.
Okay.
And the question is, what killed those cells? And what killed them are antibodies. Antibodies are protein molecules that are made in your body to attack viruses and bacteria and other things that don't belong in your body. And in this case, through what we call an autoimmune attack, your own antibodies are destroying your insulin-producing cells. And once they're pretty much gone, that's when the blood sugar rises and the person's diagnosed with type 1. So you're not born with it. It happens typically in childhood or early adulthood is when this antibody reaction occurs. And the triggers for it, there are many different possibilities, and researchers are looking at viruses as a cause. They are looking at genetic vulnerability as being a contributor, and cow's milk may also be a contributor.
Okay, that's understandable. Now, do you know what was the first case of diabetes, type 2 diabetes reversal? Is that documented? I guess it is, but are you aware of which was the first case?
I'm not sure if I know, but I can tell you the first one that I remember seeing in my own work. This was many years ago in our NIH trial. There was a man who had been a policeman in Washington, D.C., and then he worked in a bank, and he came in to see us, and he had diabetes all up and down his family tree. His father was dead by age 30.
Wow.
He himself was 31 when he was diagnosed with diabetes, several years later. But in the course of doing a vegan diet, which, by the way, he said he found very easy, if he made chili instead of meat chili, it would be bean chili. He said, this is not hard. And after about a year, he had lost 60 pounds, and he stopped his diabetes medications, and his hemoglobin A1C had been 9.5, which is bad, but it dropped to 5.3, which is totally normal. And I was very surprised initially, but now, of course, we've seen many people get rid of their diabetes. And it's now, I think the proper way to view this is that it's a two-way street. You can get into diabetes and you can also get out of it.
Okay. How many patients approximately are you treating at the Barnard Medical Center?
Oh, we have thousands and thousands of patients here. And we have seen thousands more in research studies.
Okay.
By the way, if you're ever in Washington, D.C., I hope you'll come by and see us. Because we have doctors and nurse practitioners and dietitians, and they're all really interested in diet. And they work hard, but it's really enjoyable work because instead of just throwing prescriptions at people, you're tackling the cause of disease. Now, don't get me wrong, we also use medications, we use everything that we need to as in any other medical practice. But if a person comes in with diabetes, they got that disease because of their diet, typically. And so that's what we want to focus on.
Okay. Very interesting. Hey, Dr. Barnard, once more, thank you very much for sharing this information.
It's my pleasure.
It is very important for us because we want to achieve that wellness dream here in Curacao. We are focusing much more to promote wellness. Instead of focusing on disease, we want to focus more on wellness. So this is part of this process, and I appreciate your contribution enormously. So that's it for today. Thank you very much. Yes.
Before we go, if someone has watched this and they're thinking, how would I do this? Let me just give you a couple of quick tips.
Okay.
If you think that maybe I'd like to try a vegan diet or plant-based diet, what I suggest you do is, if it sounds difficult, just take it into 2 steps. The first step is, for the next 7 days, just try out foods that happen to have no animal products and see what you like. So for breakfast, instead of bacon or some kind of meat, why not have some beans for breakfast? Beans on toast or something like that, beans with some papayas or whatever, healthy foods. And for lunch, let's say maybe over lunch I'm having every day at lunch I'm having a sandwich with chicken, or I'm having fish or something like that. Instead, have a bean burrito or whatever the case may be. So all you're doing for the first week, you're not getting rid of anything, you're just testing out foods that are free of animal products to see which ones you like. And try the same for dinner. Just try out different foods. Now, after a week, you'll know a breakfast that works for you, or a lunch that works for you, and a dinner that works for you. Then step 2 is take 3 weeks. And during those 3 weeks, eat the foods that you experimented with in the first week. The foods that you like, have them be in your diet and get rid of the animal products completely. Now you're doing it full-on vegan for 21 days. At the end of that period of time, you'll be physically healthier, meaning you'll have lost weight and your blood sugar will come down and so forth. But you'll also notice that your tastes are changing and you like the vegan foods that you're eating. And it's at that point much easier to go forward. So step 1, take 7 days to just check out the vegan possibilities, see what you like. And step 2, take 3 weeks, do it all vegan all the time, and you'll be convinced.
Very well. Thank you very much, Dr. Barnard. And
Thank you.
we will keep in touch.
I look forward to it. Thanks for all you do.
Okay. You're welcome.
Thanks.
Bye-bye.
Bye-bye now.
Okay, that was very nice. Guys, I'm so excited. We have come to the end of this interview. I believe there was a lot of information that maybe new for you, but just take your time. You can watch this video over again and take notes. And if you are interested in the book, because Dr. Barnard wrote a book on how to reverse diabetes type 2, you can order it online or you can order it by Mensing. I myself ordered it already. So it's on its way, and I will let you know when it's here. Okay.